Hi, and welcome to this ABC vascular ultrasound video case study, suprarenal abdominal aortic aneurysm in a patient with a previous repair for an infrarenal abdominal aortic aneurysm. This patient was found to have a 5.4 cm suprarenal abdominal aortic aneurysm. This is the B-mode transverse view of the suprarenal abdominal aortic aneurysm. We can identify Mural thrombus, and as we move the transducer caudally from the epigastric region, we can identify the tube graft used to repair the infrarenal abdominal aortic aneurysm. We can turn the transducer in longitudinal to better appreciate the connection between the tube graft and the suprarenal abdominal aortic aneurysm, which appears fusiform in shape. Due to the presence of bubble gas and poor visualization of the graft and aneurysm, we can use the phased array. This will allow us a better penetration and visualization of the branches arising of the suprarenal abdominal aortic aneurysm, the celiac trunk and superior mesenteric artery. Also, longer section of the graft can be visualized using this transducer. Thanks for watching ABC Vascular Ultrasound.